We know the hospitals were built on racism. The hospital system was created, enslaved people were freed. The government said, let them die on the streets. The hospital said, let them die on the streets. They were literally walked onto slave sites and plantations and said, hey, y'all free, and then walked away. These were people that were in bondage for over 100 years. So they had no idea what freedom looked like or what freedom felt like. And so they started getting ravished with diseases and bacteria. But instead of the hospital systems welcoming them in, the hospitals were created for white individuals. And so what we saw was they allowed these enslaved black people or newly freed black people to literally die on the streets to prove that black people were meant to be enslaved. And so this is the system that was created. And then in addition to that, we saw the introduction of white OBGYNs into women's health. And when they came in, they said black midwives who had traditionally delivered most of the babies were incompetent, they were dirty, they were full of infection. And then white public health nurses joined in that fight to the point where black midwives were hunted down whenever they did decide to deliver. And so what we know is from those systems, from that creation and racism being created in the healthcare system, from all of that, and then our own internalized oppression and internalized racism, white patriarch always rules. And so we continue to seek care in these systems because white patriarch has instilled in us in this internal racism that they are better. And so we as a community continue to seek out care from what we feel like is better.